Can chronic pain patients become addicted to opioids? So yes, absolutely. It is a very thin line between somebody who's been using chronic opioids to treat their pain and who become dependent on it. This is a natural phenomenon that occurs because these drugs are so addictive. They change the brain's chemistry to the point that if the person was to suddenly stop taking this pain medication, the opioid, that will precipitate withdrawal, and then we will get very sick and uncomfortable. And the best, quickest way to avoid feeling so ill is to take another pill. And so it's very common, but this doesn't mean that every person who has been on opioids for long-term use is addicted. They may be dependent, like their body is dependent on it, but it doesn't mean that they're addicted. Addiction itself, or substance misuse, really implies a whole host of other things, more in addition to the dependency, the interference in their life. In this situation, it's they are no longer coping well, or they're relying on their drug as a crutch. They're treating themselves for emotional pain with the opioid. They're lying, they're deceiving. Those are signs of a full-blown addiction as opposed to just a simple dependency. So that being said, it is important though for somebody who's been on long-term opioid use to try to wean down. This has been the latest suggestion. That's the healthiest thing to do. They should seek medical attention and have an open discussion with their physician to see if a weaning or tapering is possible, and to try to get them down onto the most comfortable dose possible, but without causing them to lose any quality of life. So the fear is that if a person's weaned down too quickly or too much, that they go through withdrawal and they feel very miserable, and this person was less likely in the future to try to go on any sort of wean. So it's important in that situation for them to be prescribed it, lower doses gradually, and if it doesn't work, for the physician to document it, explain what happened, and to resume them at a slightly higher dose. This doesn't mean in the future though that they can't try again to wean down. So it's important to realize that, in summary, that people who are chronically on pain medications, opioids, not all are addicted. However, many probably would be dependent. The ways to avoid this though is to minimize how much a person is taking, minimize the dose, and try to increase the interval between taking it, and to try to wean down off of the medications completely if possible, but this needs to be done with the discretion of your physician to prevent going through into acute sudden withdrawal. If you have any questions or concerns, please leave it in the comment box below. Thank you.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.